Now, with every couple that comes to our office that I consult, there is something unique that is preventing them from having conceived the baby that they so dream of. And when they come to me, I will share with you that what I have noticed for women is one of the main causes of fertility that I've seen: anxiety, depression, all of these things that change the body balance enough to impede pregnancy in a woman. And that all begins on a soul spiritual level, ladies. Remember that. Especially if the emotional stress is literally about the fertility problem itself. Yes, there may be some physical challenges, but remember, there is a cause and then there is an effect. And it does begin on a soul spiritual level first, as I have discussed in videos and in talks and in speaking engagements that you guys have seen ever since 1995 that we began practice. I have shared with you that it begins on an emotional soul level first, then it affects the physical. For example, a patient that may have challenges with her ovaries. Maybe she has PCOS, polycystic ovary syndrome, or just simple ovarian cysts, or there are blocked fallopian tubes and such. Know that what we know from ancient medicine and what holistic medicine teaches us, naturopathic medicine especially, is that unconsciousness, thought, emotion is the thought emotion on a soul spiritual level that affects the health of the ovaries and the testicles in the man. What is unconsciousness, thought, emotion? That is, think of it as building up a wall and blocking one's feelings. The image, for example, on a chart that I have utilized with patients so that they could understand the correlation between how thoughts and emotions affect certain body systems and organs of the body directly. On that chart, you see a figure whom has passed out on a couch and the glass of alcohol has rolled out of their hand. What does that tell you? That person is numbing their feelings. They don't want to feel whatever they are experiencing in life, whatever stresses and distresses they are experiencing in their world, in their circle, in their realm. And so they are numbing their feelings. It is as if they are building up a wall and blocking their feelings because they're afraid to get hurt again, or they're afraid of someone getting too close, because they don't feel the same way towards someone or some people the way they used to. Maybe even saying, I care for you, or I love you, becomes hard, but it's this. It's a blockage. And when we do that, when we hold on with so much fervor to that unconsciousness, thought, emotion, then it's as if we've also built up a wall. Apart from the emotional wall that we've built up, it's a wall of abnormal cells that can also then answer and develop within the physical body. Think of those cysts. And it's a wall that now covers those organs or causes those blockages that prevents anyone from penetrating and getting to the very you. That has to be solved first before I can help them to conceive that baby that they so dream of. We have to work on that level as well. And then, of course, bring in the natural therapies and the nutrients that are going to help this body, that body, to actually be fertile, to produce viable eggs, to unblock tubes that are blocked and such. That is part of the process that needs to happen. But other physical problems that could cause a woman to have challenges with fertility are things like severe anemia, endometriosis. All of these things must be looked at and addressed pre-conception. And of course, there are other factors that I discuss within my book, but all of you are so beautifully unique that you must take into account these factors are crucial to be considered, and not just looking at the physical body. That is where a lot of my colleagues go wrong, where they only look at the physical and push towards other invasive ways to try to help a couple conceive, when it's really one of the most natural things in the world for two humans to do, to conceive and bring a baby into this world.